Good morning, class.
Good morning, Ms. Carminati.
Today we're going to practice what we learned about toe shortening 101, and we're going to choose the best student on this topic.
Heather, do you have a pen?
Yeah, sure. Alright class, as you already know, a foot deformity such as long toes oftentimes requires surgical treatment. But how does exactly toe shortening surgery go? Toe shortening surgery is a quick outpatient procedure, which means that the patient will be back home the same day after surgery. The surgery might take anywhere from 1 to 3 hours depending on the condition of the foot and severity of the deformity. Since it's a minimally invasive surgery, the surgeon will make a small incision to allow them access to the bone to fix the toe. Some implants or K-wires are used to keep the toe straight while it heals. Some of the techniques that can be used for toe shortening are arthroplasty, which means that the surgeon will make a small incision to remove a part of the small toe joint to shorten the toe. The other technique is called bone fusion, otherwise known as bone mending. This technique requires for the surgeon to remove the small toe joint, which means that the two ends of the bone will fuse together and heal. Depending on the complexity of the case, the surgeon might need to perform other procedures like corn or callus removal. Okay, Haley, that was perfect, but let's make sure next time we give time for others to participate.
Yes, please.
Alright, so what are the symptoms of a long toe? Heather?
Some of the symptoms of long toes would be pain at the tip of the toes. You know when you wear heels and they're really tight up front? Yes, that pressure against the toe makes them hurt like corns. And also inflammation on the toes, like redness, swollen, all of that.
Oh yes, symptoms are easy, but do you actually know the cause of a long toe?
Well, yes, they are caused by,
It's a genetic condition. So nice to hear you talk, Holly. I would like to hear that more often. Alright, moving on. When is the right time to seek treatment? Go!
Well, there isn't a right or wrong time to seek treatment for this condition. Most patients seek treatment just strictly for cosmetic reasons and others as a medical necessity. The most common reasons are worsening toe pain, painful corns or calluses, worsening deformity, or the appearance of the foot.
That's a great answer. Thank you, Ms. Carminatis. Now remember that anyone that has a long toe is a good candidate for toe shortening surgery. It might be because they don't like the appearance of their long toes or because they have a medical necessity. Now, Heather, can you tell me how much is the cost for a toe shortening surgery?
Alright, so it depends on the severity of the long toe. It also depends on how many toe shortenings we're doing at the same time and the technique they're using. It usually goes from $2,000 to $2,500, and so if you can pay $500 for a pair of heels, then why not pay for surgery to make your feet look better in them?
Oh please, you're really just gonna do it because of the heels? It can also ease pain, discomfort, and it has symmetry and balance. And also, you're both right, but it also improves their self-esteem. Some patients really don't like the appearance of their foot because of their long toes. So having toe shortening surgery is really gonna help with that.
Surgery is the way to go.
Now, everyone tell me one benefit for toe shortening surgery. Heather.
One benefit could be that it improves self-confidence. It makes them look way better. Pretty feet.
Haley. Your balance will also be improved. The second toe has an important role in that, so by fixing it, it will be quite helpful.
Helen.
It becomes easier to find footwear that fits perfectly and doesn't put pressure on the toes.
Holly.
It's a minimally invasive surgery. It's about 2 centimeters compared to the foot.
Oh my god, where do you have that? Ew, gross. Is that real?
Oh, please, Heather. That's obviously fake.
Can I see it?
Alright class, back to the topic. Who can tell me the risk of the procedure?
The risk of toe shortening surgery are infection of the surgical site, pain and swelling, stiffness or weakness of the toe, poor wound healing, problems with bone healing such as non-union, unbound union, nerve damage, floating toe, and reoccurrence of the deformity.
Good answer. Now, can someone besides Haley answer what's the recovery for toe shortening surgery?
The recovery for toe shortening surgery depends on the severity of the case, complexity of the deformity, and the technique used to fix the deformity. However, the recovery time takes about 6 weeks, but if the surgery had any complications, up to 3 months.
Oh please, recovery is an easy topic. Can you actually tell me if a patient can walk after surgery, Helen?
Although it's a minimally invasive toe shortening surgery, If you had one foot operated at a time, then you should use crutches or the help of a knee scooter. But if you had both feet operated on at the same time, then you should use a wheelchair to get out of the surgery. This is to prevent any weight bearing and to not cause any damage to the recently operated foot. And now, Haley, can you tell me if you can drive after surgery?
This depends on which foot you had surgery on. If you had surgery on the left foot, then yes, you can drive shortly after surgery. But if you had surgery on the right foot, then you have to wait until the surgeon's recommendations. Do you know what happens after toe shortening surgery?
Of course. After the procedure, the patient will be in a post-op shoe that has been provided to them. They will wear this for about 2 to 4 weeks per the doctor's instructions. And after, the pins will be removed, and this is when they can start wearing tennis shoes. After 6 to 8 weeks, when they're fully recovered, they can start wearing heels again. Now, pain won't be much of a trouble. They would feel a little bit of discomfort, but nothing that cannot be fixed with over-the-counter medication.
Alright, you two girls are obviously on top of the class, so now let's decide who is the best. I'm gonna give you guys a case. I'm gonna be a patient that is scared of having toe shortening surgery. What would you guys say to me?
If patients are scared, they need to understand that it's a minimally invasive surgery. There is less risk, less trauma to the tissue, and quicker recovery. Well, I know that surgery can be scary, but toe shortening is a simple outpatient procedure. There's going to be less damage to the tissue, which means less pain, just a little bit of discomfort, and quicker recovery time. Plus, I will be here through the whole process with you to help you make your feet prettier.
Well, I think we have a winner. Congratulations, Helen.
Oh, what did I win?
I don't know. That's not on the script. Hi, this is Helen for Luxe Foot Surgery. How can I help you?
Hi, I found you guys on Google. I have a long toe. Can you help me with information on toe shortening?
Yes, of course I can help you with that. What information about toe shortening do you need?